room, and I'm going to provide privacy. Introduce myself. Hi, my name's Lizanne. I'm going to be your nurse today. The doctor ordered for a urinary catheter insertion. And do you have any allergies to latex or to iodine? No? Okay. And can you just verify your name and date of birth for me, please? Okay. I'm just going to check it with your bracelet. Thank you, Mrs. Simmons. And I've also checked the patient's chart to note that she is not allergic to iodine or latex. Gloves on. Do you have any issues with laying flat? And do you have any pain on a 0 to 10 scale? My patient reports that they don't have any issues lying flat and they have no pain. Alright? I'm just gonna put the bed up at waist level. And I'm gonna lay you flat. Position my patient.
Alright. Next I'm going to put on sterile gloves. Once again, 1 inch border.
Putting a chuck down for trash.
Okay. Open. This will be brand new.
Exposing the necessary area. And positioning my patient's legs, asking her to rotate her legs outward and have them bend. And take off my clean gloves, and I'm now ready to start setting up my sterile fields.
Good. I am going to begin with my left hand.
I gathered all of my supplies. I noted that everything was in here. There's a pair of gloves in here, but I also grabbed my own.
Slide hand in. Now it is very important that you use appropriate size gloves. Again, just touching the top. That right there.
This aside for after to date an initial. Open, making sure to keep a sterile 1 inch border.
With this hand, you can only touch the outside of this glove, but this one is still on the inside of the cup. So I'm going to try and slide over. Then I'm going to stick my fingers under. Once again, very important to have gloves that fit you.
And I'm now going to perform hand hygiene, making sure to keep an eye on my patient this entire time that I'm setting up my sterile field, and I will not turn my back to it
Careful
either.
not to break sterile technique. Okay, I'm going to go through my product.
And I'm just going to take the sterile gloves out of here. Making sure to maintain my sterile 1 inch border.
I'm going to just soak some gauze, and I don't need this, so that can go outside my sterile field.
Keeping an eye on my patient the entire time.
Okay, so the sterile field.
I'm going to start by grabbing my non-dominant hand, making sure to only touch the inner part of the glove.
I'm over here, and I'm just going to open these a little bit, not turning my back on my sterile field. And I'm just going to place them in the ceiling.
And now
Well, these
grabbing
soap,
only
I'm
the
going to
inside
clean
of
my
this
wound.
glove.
I'm going to open my swab sticks. And we begin by going from least to most contaminated, top to bottom. I'm going to start on one side, and I'm going to do a twirling motion all the way down. I'm going to do the same on the other side.
I'm able to touch the outside of the glove because this hand is also sterile, and I can fix this cup by sticking my finger
Swirling motion.
and only touching the inside. And I no longer need this.
And I'm gonna do one right down the middle. Again, top to
Now
bottom.
going to grab my drape.
Swirling motion. Now we're gonna get ready for packing.
Place my sterile field under my patient, making sure to keep an eye on my sterile
One of
field.
my hands are gonna be done clean, one is gonna remain sterile.
Now I'm gonna place my fenestrated drape.
I'm sorry, sterile. I'm gonna take 4 steps. And with my still sterile hand, I am
Place
going
it on my
to come in here
patient.
and, rinse
Being aware of my sterile field the entire time.
saline from our gauze. Okay, keeping this
And now
hand
going to set up
still.
everything for my catheter insertion. Making sure to be aware of my 1-inch sterile border. This would be used for a urine sample. We don't need that today.
That did not touch anything, but that would be a contamination if it did. Then
My
take my
lube.
clean hand.
I can place the catheter tip into it. Gonna grab my catheter tip.
Okay.
Being careful so I don't flop it.
Edges of the balloon to the outside skin. And use your 4 steps.
Insert it into the loop.
In. Alright. Next I'm gonna cover it with a 4x4 gauze pad. Right. Keeping it still with my sterile hand. Now I'm going to take the ABD pad.
Now going
And
to
I'm going to place it over.
the syringe, the balloon inflation.
Now I am going to take all 4
That's it.
edges.
I'm not going to use this, so I'm able to throw it on the floor. Now going to move all of my supplies to the bottom of my patient's feet. I'm going to let my patient know that I am going to be working down here, and she may feel some pressure as I'm going. I'm going to make sure to keep my left hand in place because it is now no longer sterile. I'm going to start on the left side, making sure to twirl down as I
All
go.
4 edges, and I would date with the time of the weekly and my
And now on the right side, twirling down as I go,
And as my patient is comfortable, if you need nice
making sure not to touch my hand or anything else with the sterile swabs. And now down the center of the meatus, twirling down as I go.
every sterile field.
And while maintaining,
I'm like with my gloves.
holding the
With my gloves. I'm like,
labia open,
did I touch my? I don't think I touched myself.
going to take
What?
catheter out of the loop and feed it into the meatus until I see a urinary return and about 2 to 3 inches in after that. I've now seen a urinary return. Going to inflate my balloon about 5 cc's.
That's okay. Because I have.
Give my balloon a little tug to make sure it's in place. I'm now able to clear up this area a little bit. Take off my sterile gloves. has been inserted, I no longer need sterile technique. Try that again. I'm going to write my name and initials and the date and time and secure this on the bag. I'm going to use it as tape right now and secure this to my patient's leg, making sure to leave some leeway so that my patient is not uncomfortable. I would tape this to my patient's leg and then put it on the edge of the bed so that the urine was able to flow down. And I'm going to return my patient into a comfortable position. Putting the bed back down to make sure that my patient is safe, and I'm making sure my patient is comfortable. I'm now going to re-enter the room because the doctor has ordered for the catheter to be removed. Reintroduce myself. My name is Lizanne. I'm going to be your nurse. The doctor has ordered for the catheter to be removed. I'm just going to heighten the bed. And do you have any issues with laying down flat? And do you have any pain at the moment? Okay, thank you. Just going to put the bed up. Just going to double check your wristband. I'm laying you flat once again. Perform hand hygiene. And put on clean gloves to remove the catheter. And I'm going to position my patient. My patient bend her legs up. I'm going to place a chuck at the end of the bed and underneath her just in case, so I do not make a mess. And I am now going to make sure that the bag is empty at this point and make sure that there is no urine in the tube. I'm going to detach the catheter from my patient's leg. And I have checked in the chart to see that there were 5 cc's put into the balloon. So I'm looking for 5 cc's when I deflate it. And I have gotten the 5 cc's of return. Now I'm going to tell my patient that she's going to feel some pressure, pulling, well, some tugging. Pull the catheter out. Able to give my patient comfort and give her privacy. Put the blankets back over her. Return the bed back down to its lowest position. And my patient has the bed up as it was when I came in. And that completes a urinary catheter.